Good afternoon, everyone. I'm Dr. Reimer, medical lead of the Vaccine Implementation Task Force. I do have a few items that I wanted to touch on this afternoon before we go to questions. The first was something that we included in today's vaccine bulletin and was shared with Manitoba's health providers last week. So we are now allowing COVID-19 vaccines to be given at the same time as other vaccines. This is consistent with updated guidance from the National Advisory Committee on Immunization, which was released on September 28th. So before this, just as a precaution, NACI had recommended that people who got the COVID vaccine should be getting other vaccines at least 28 days before or 14 days after other vaccines. As you can imagine, this can make the scheduling of vaccines very complicated. And especially as we're now getting into the time of year where we typically start giving seasonal influenza vaccine. So to be clear, this is what we already do with many other vaccines. If you think back to childhood immunization or your child's immunization schedule, it's likely that they got more than one needle in the same visit. So this will make it easier for people who want to get one or more vaccines. So for example, if you get a seasonal flu shot and you need a COVID vaccine, you will be able to do that at the same visit. This is reducing another potential barrier for immunization because it means that people don't have to make multiple appointments to protect themselves or their loved ones. And it helps ensure people are protected against as many serious illnesses as possible. The second thing that I wanted to update you on today is the COVID-19 vaccine campaign in schools. So we know currently about 70% of students who are in grades 7 through 12 are fully immunized. To date, we have held clinics in about 50 schools throughout the province, and many of those also included after-school pop-up clinics for parents and other members of the community. In total, we've given approximately 400 vaccines through these clinics, including just under 300 to eligible young people. We also gave over 100 doses to community members, which is wonderful to hear that the clinics are also reaching other members of the community. And over half of the doses in these clinics were first doses, which is also really great to hear that we're reaching people who are at this point unprotected. At this stage in the pandemic, every dose and every person that we can protect with the vaccine is important. Increasing the percentage of students fully immunized will reduce the risk of outbreaks and support the safe return to school, and will help keep students and staff in the classroom. With that goal in mind, we have clinics scheduled in another 100 schools this week. Offering the vaccines in schools is another way that we can make the vaccine more accessible, helps to reduce barriers for anyone who hasn't been able to make it to another location to get vaccinated. So I want to send a huge thank you to our regional teams, our public health teams who are making these clinics happen. A thank you to the schools and school communities that have opened their doors to this vital work, and to the parents and young people who have chosen to take advantage of these clinics. So finally, also in the topic of school vaccines, I wanted to speak briefly about the work underway to ensure young people are caught up on their other immunizations. Many people from grades 6 through 12 may have missed at least one childhood routine immunization over the last few years as we were all focused on the COVID response. But these vaccines are also really important. We don't want to create a situation where entire groups of young people are at risk from some of these very serious illnesses. So this includes things like hepatitis B, meningitis, whooping cough, and polio, as well as the HPV vaccine. Many of us have been fortunate enough to not have to experience these illnesses in our lifetime because of these vaccines. And we'd really like to keep it that way. We certainly don't want to see a resurgence amongst Manitoba's young people when we have a way to prevent them. We did send out letters to parents and caregivers, and there are a few options where you can catch up. Many of these are available by appointment at our super sites, or you can get the vaccines from your regular healthcare provider. We are also planning to have public health teams come back to the schools later this year to offer the routine immunizations. But of course, we recommend that you don't wait, if at all possible, and make an appointment to get these vaccines sooner if you can. And that's all I wanted to say today. So with that, we can open up to questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CTV Winnipeg, Michelle.
Good afternoon. I wanted to start with Dr. Roussin. I mean, the calendar's flipped over to October. We're heading into the time of year where, holidays and events are kind of concurrent with a wave of COVID. So Halloween is the first one that comes to mind. What is public health recommending this year? Are you already thinking about Halloween?
Yeah, and so certainly we're looking at all type of areas where we see gathering, especially indoors. So with Halloween, we're starting to look at what how our guidance will be. It's going to be, again, sticking with the fundamentals, all these things that we've been talking about now for over 18 months, trying for that distancing, staying home when ill, hand hygiene, masks where appropriate, outdoor activities safer than indoor activities. So we'll be having some more guidance as things come, and of course our epidemiology might look a lot different as we get closer to Halloween, but the fundamentals will remain the same.
Just to follow up with you, Dr. Reimer, on the school vaccines, is there not a high uptake on these routine vaccine offerings? Like, why the reminder again for people to do these?
Well, we have seen appointments being made at our super sites, but we know that there are still many youth and children who have not received all of their routine immunizations. So the reminder is really just to try to get the numbers as high as possible to avoid any additional outbreaks. Kids have had a really hard time with school over the last year and a half, having outbreaks related to COVID, and we don't want to add to that and experience any other outbreaks. So we just wanted to remind everyone that these options are available, and that even though we will be coming into schools, that we don't want parents and kids to wait. We really do want people coming in to get those vaccines as soon as possible, especially now that they can get them at the same time or at any time after, before getting a COVID vaccine.
From CHVN, Taylor.
Hi, good afternoon. I'm wondering why Southern Health is always being lumped together with the health orders. It's a pretty big area with towns with very different case rates and vaccine uptake. Yeah, I'm just wondering why.
So targeted restrictions, especially geographically, are difficult because of mobility. So trying to decide on what precise geographical region is, what will most people recognize as a geography that they're familiar with, and where, of course, where the epidemiology is. So very, very tight geographical targeted restrictions will just make mobility that much easier, right? If you can just go right next door to something that is not restricted, then we're not going to achieve anything. So with every restriction that we've had, there's always areas that are restricted to different areas or to different degrees than others, and I think we've heard at every iteration of our orders that people feel unfairly targeted with it. So we know it's very difficult to have these type of restrictions. Right now, these are mostly related to unvaccinated. We do have some geographic requirements on these orders, but then the alternative is to have a very tight geographic order where mobility is just enhanced, or put that restriction province-wide, where it's even affecting even a greater amount of lower risk individuals. So this is where we decided, and we'll continue to reassess that over time.
Thanks. And when these new orders were announced last week, before that, what kind of consultation was done with Southern Health's own governments?
Well, there's a lot of interaction at the governmental level. I'm certainly not involved in every interaction, so we can get you an answer to that question. But there's a lot of stakeholders involved, and decisions have to be made relatively quick. So I don't have any necessarily specifics on that.
From the Winnipeg Free Press, Danielle.
Hi, my first question is for Dr. Roussin. I was wondering if public health is planning to deploy any additional resources to regions where there's high level of community spread, such as maybe a mass rapid testing campaign.
We do have rapid response teams that we can and have dispatched to areas of increased cases or outbreaks. Certainly our contact tracers throughout the province will contribute to areas where there's more transmission. So other regions are contributing to help out with Southern Health where we see increased transmission. So we do have those type of targeted campaigns that occur.
Okay, thanks. And my second question is for Dr. Reimer. I was wondering, with the move to offering third doses for long-term care residents, is it all residents who should be getting that third shot, or are there differences based on age, date of immunization, and perhaps interval length?
Well, we are recommending that all residents in licensed personal care homes should get a third dose 6 months after their second dose. And that was taking into consideration a lot of the factors that you were just talking about. So we know that with older age that the immune response can be weaker. We've seen evidence that the closer time period between dose 1 and dose 2 was not as good as a longer time period in creating a strong and lasting immune response. And we know that people living in personal care homes are more likely to have other illnesses that make them higher risk of severe outcomes. So all of those factors together is where this recommendation came from. But certainly the more of those factors that apply to any individual, the more important this third dose would be for that individual. And so the medical directors of each of the facilities can review the individual health circumstances of each resident to determine, what priority it is for that individual, even amongst the fact that we're recommending it for all of the residents.
From Global News, Will.
Good afternoon to you both. Dr. Roussin, the last set of COVID modeling we received, I believe, was late August, mid to late August. Now that we're in the fourth wave, I'm wondering, do you have a sense of which trajectory we're currently heading down, or what can you infer based on what we're seeing right now?
Yeah, and so we update that modeling, over time. The actual models, the projections haven't really changed over time. Right now, we're tracking on the severe scenario. So we are seeing case numbers go up. We are seeing significant increases in hospitalization and ICU, and certainly some regions are contributing more to that than others.
Okay, thank you very much for that. There's a sense, based off some conversations we've had with mayors, community leaders, other epidemiologists and the like, that there just won't be enough buy-in on tomorrow's public health orders, specifically those targeting the unvaccinated, for them to be effective. And I think the question on many people's minds is, what happens next? And is public health prepared for that?
Well, we're in a trajectory right now that could take us to a place where we'll see quite a significant amount of strain on our healthcare system unless we change it. And so the public health orders are one tool we use for that. Messaging, we have targeted campaigns in Southern and other areas. We certainly have had a significant vaccine uptake that hasn't stopped. We still have vaccine uptake daily. And then the orders are such another tool. And, I think it's correct. These orders are not going to have much an effect unless there's adherence to them. And part of adherence may have to be enforcement. And so, so I think that's what we're counting on, that Manitobans seeing the trajectory we're on, seeing the increase in ICU, seeing the toll that this is taking on both COVID patients and non-COVID patients, and to change, to follow these directives and to do whatever they can to decrease the transmission of this virus, or we are going to be into a very, very significant fourth wave here.
From the Brandon Sun, Kyle.
Good afternoon. My question's about Christian Heritage School here in Brandon. Christian Heritage officials have told me that their COVID outbreak, of which there's currently 17 cases, is only relegated to their grade 3 class, maintaining that all their other cases that they've received in a grade 1, 4, 5, 6, and kindergarten class were all acquired outside of the school. So I was just wondering if the provinces shares the school's viewpoint on how this outbreak has transpired.
Yeah, I don't have details on to that level of there, so we can try to get you a response from the region on that.
All right, thank you. And my second question is also about school outbreaks in general. Like, how bad does a COVID outbreak have to be at a school like Christian Heritage before the province steps in and forces them to transition to remote learning?
So again, it's going to depend on the specifics of what we're seeing, where the transmission is occurring, where the acquisition is occurring, vaccine uptake, all these factors will play in. So we know that schools have been shown to be safe in all of our ways. I certainly see transmission there, but most of the transmission occurs in the communities, and trying to keep that community transmission down is the big goal, so we can keep those kids in school. And of course, there's a significant benefit from keeping kids in school. So all that has to be weighed before we send kids home from school.
From CJOB, Rosanna.
Hi, doctors. If people aren't getting tested themselves, what other proactive ways are you looking into to ensure that people do get tested to prevent transmission besides contact tracing and upcoming public health orders?
Well, like most parts of this response to the pandemic, we need Manitobans to buy in. And so things like the fundamentals and staying home when ill, getting vaccinated, that also includes getting tested when you're ill. And so one of the problems we've seen is that a significant proportion of those people being admitted to hospital in the ICU are being tested for the first time upon admission to hospital, which means they've been ill for a week or more without getting tested. So it tells us that we're not getting the testing uptake that we need. So we're going to keep the messaging out. We want to have access to testing as much as we can, and we do some targeted campaigns where we see lots of transmission and outbreaks, but ultimately we do need Manitobans to buy in.
Thank you. In a couple weeks, those select government employees who aren't vaccinated will have to get tested 3 times a week. Do we have a more concrete idea of how many people that will be and when we'll know, and how much of an expense is it for you to test someone that many times?
I don't think we have the details quite yet on that. We're going to have to just see how how many people declare their immunization status, and then we'll have a better sense on that. And of course, then the cost will all depend on the quantity of people that's going to be needing testing.
From the Winnipeg Sun, Glenn.
Yes, good afternoon. Again, we're seeing increasing numbers from Southern Health that are, in excess of Winnipeg's. With the new public health orders coming into effect tomorrow, is there any thought that perhaps we need, to do more to over the fact that there are all these these cases in Southern Health?
So we have been concerned about transmission overall, but especially in Southern Health, we see those significant increases in numbers, and even absolute case numbers are exceeding those in Winnipeg right now. And so about 15% of the population is making up a significant proportion of our cases at this point, and that includes ICU admissions. So, so by having our orders, which largely affect the unvaccinated, then that disproportionately affects regions and areas where vaccine uptake has been lower. And then we do have some targeted restrictions in Southern Health. And, like I've said, the orders are in place. They can only achieve their goals if they are adhered to. And certainly part of that adherence can require enforcement.
I know you were asked about, I know you were asked about Halloween. Thanksgiving is just this weekend. Is there any recommendation from public health on, I know last year the recommendation was not to have Thanksgiving, but as in not have large gatherings for Thanksgiving. What would be the recommendation this year?
Yeah, and so this year it's really to focus on adhering to these public health restrictions that will be in effect. So those who are fully vaccinated can continue to meet in private gatherings without restrictions. Certainly everyone should be following the fundamentals at that time. So everyone staying home when ill, and hand hygiene, and an overall outdoor gathering is safer indoor, and whenever possible to keep that distance. But if gatherings are going to include individuals that are unvaccinated, then those gatherings need to be limited to one other household if it's going to occur indoors.
From CBC Manitoba, Bart.
Hi there, Dr. Roussin, or rather, Dr. Reimer, forgive me here. On your vaccine bulletin today, you have a total of 1,978,000 and change vaccine doses. On the dashboard, we have 1,990,000 and change, a difference of 12,000 doses roughly. Which one's correct? One would imply the usual 5,700 over about 3 days, which is pretty normal. The other would have a big jump and a data correction. Which one's right?
I'd have to take that question away. I don't know exactly the bulletin versus the online where they're pulling their numbers from, but certainly someone from communications can work with our EPI team and get you an answer for that.
All right then. Dr. Roussin, you've been asked a number of different ways, and I appreciate it. You have some messaging you like to stick to, but I got to ask you point blank. What makes you think people who haven't been adhering to any kind of restrictions will adhere to your newer restrictions tomorrow?
Well, I think it's a concern overall, right? And we see the numbers going up, so we work on that messaging. We have the orders in place, and we need people to adhere to them, or we're going to continue to see these numbers increase. So part of that is messaging, part of that is outreach. There's a lot of work being done by a lot of people in the region to work on vaccine uptake, to work on the messaging on the importance of this. And then of course, along with adherence, we need to have enforcement on these. So, we've, throughout this entire pandemic, there's always a significant reliance on Manitobans to step up to do the right thing. And so that doesn't go away here, but we do have more strict orders coming in, especially for the unvaccinated. and we need to see how that messaging works. But enforcement certainly has to be a part of that.
From the Canadian Press, Steve.
Oh, hi there. I noticed the test positivity rate provincially has risen quite sharply in the last little bit. In Winnipeg, it's still low. Can you tell us what and where is causing the rise?
Yeah, well, certainly the transmission and test positivity in Southern Health is contributing a significant degree to that. In other areas, such as Northern, we have some localized outbreaks, which are contributing to significant test positivity as well, and as well as in other regions. So in most other regions, we're seeing an increase that's related to specific outbreaks.
Okay, and I know enforcement doesn't fall directly under you, but obviously you have some interest in it. Have you received any assurances from the province or the Justice Department that enforcement is increasing tomorrow or in the coming days to enforce your new public health orders?
So, well, I mean, enforcement's always been part of our response. So enforcement has always been there. And then again, we work at that whole government table where the justice is present to discuss issues such as enforcement. So that's really a question towards them.
From CKDM, Trillian.
Hi there, Dr. Roussin. I was just wondering, it seems like in our region, neither the vaccinated people or vaccinated people are happy with these new rules that are being implemented tomorrow. And what would you say to them?
Well, I mean, I think it's understandable from everyone, right, that we've been at this for over 18 months. And so I think there's a lot of fatigue out there. But it's just a matter of alternatives, right? And so with these restrictions in place, this is really to avoid doing whatever we can to avoid overrunning the healthcare system. So the healthcare system is there for both the vaccinated and unvaccinated. So it's there for both COVID care and non-COVID care. And so not liking the restrictions is certainly understandable. But what is the alternative to not having them is the question that we need to respond with. We're facing a very significant fourth wave. We don't have to look very far to see the effects of that fourth wave. And so these restrictions are there to prevent that.
Okay, thank you for that. And I was also wondering, I know you've been asked some questions already about enforcement and people adhering to the rules, but how do you feel the government can effectively enforce these rules?
Well, I think the big thing is that enforcement is only one part of the puzzle. So certainly enforcement has always been part of it. Enforcement does occur, and it will continue to occur. But it's only one part of it. That outreach that's occurring from many of our partners and in all regions is going to continue. Our public health messaging is going to continue. Our messaging about the significant climb in cases and hospitalizations and ICUs, our messaging that we're seeing very, very, very few people enter ICU if they're fully vaccinated. And so that vaccine is the best way to protect yourselves, protect the people around you. And we're really in our fourth wave right now. And numbers will continue to climb unless Manitobans step up, follow these restrictions, get vaccinated.
All
Okay,
right, folks, we've got time for a couple more questions. If anybody wants to jump in, go ahead.
Dr.
Yeah,
Roussin,
I just follow up.
here, but you just said, when I asked you what makes you think people who didn't adhere to adhere, you said you hope they do the right thing. What makes you think they'll do the right thing if they haven't been doing the right thing? I mean,
Well, I mean, we need to, we've never said that enforcement, is required. Like enforcement is part of the piece. So we are hitting this fourth wave. we're presenting evidence that's just very clear of the benefit of being vaccinated. We have restrictions in place that largely target geographically where we're seeing a lot of transmission, and as well in within the population level and the unvaccinated. So we're putting that message out. We do need people to adhere to it, but enforcement is there for the people who may choose not to.
And Dr. Roussin, are we any closer to getting a yay or nay on getting the test positivity rate in Southern Health and some of these regions where, just given the Winnipeg rate versus the provincial rate, the test positivity rate is obviously very, very high somewhere to drive the provincial rate up that much?
Yeah, and so it is high. Obviously, in Southern Health is our highest positivity rate. We don't necessarily give the specifics out just because we see such a day-to-day variability on that. What we do know is that the provincial rate is going up because we're seeing increasing transmission. The most significant transmission right now is occurring in the Southern Health region, which is also significantly contributing to our ICU admissions. And so, but we were always cautious about the specific test positivity just because we see such a day-to-day variability.
And on that note, Dr. Roussin, I was told 11% on Saturday by somebody who is credible. Is that correct?
Yeah, like I said, it's the if you're speaking about Southern Health, it's a highest test positivity. It's quite a significant test positivity, but we do see a lot of variability. So we're not releasing the specific number at this point, but it is significantly higher than what we're seeing in the province and very significantly higher than what we're seeing in Winnipeg.
All right, Dr. Roussin, can I ask about Christian Heritage School again? I just noticed on today's bulletin that it says the outbreak has been declared over. Could you just give me some insight onto how the province came to that determination?
So it's going to be the regional public health that would come to that decision, who investigates and manages the outbreak. So it'll depend on where cases were acquired, how many cases have resolved, how many of contacts are done with their incubation period. So it depends on a number of factors.
Hi, Dr. Roussin, it's Danielle from the Free Press. So you spoke about sending rapid response teams testing into areas of concern, like with outbreaks. So are there defined outbreaks occurring in Southern Health? And how many are associated with workplaces, for example?
So there are some outbreaks in every region. I would say that in Southern Health, we're seeing the most transmission still in household contacts and community transmission, but there are some outbreaks that are occurring there. So really, the region leads a response there. There are, as part of that rapid response, there's things like contact tracing, vaccine, access to testing, this kind of nature. I don't have the specifics of where any of those are at this point.
At what point do you look at workplaces and decide that they need to be perhaps closed temporarily, or have employees attend only based on vaccination status in order to cut back on that community spread? We talked about schools previously. What point do you look at workplaces in the region?
Yeah, so it depends again on the nature of that workplace, what other sort of public health measures can be achieved within that workplace. The amount of transmission that's occurring, if we can link it to that workplace, and then all the other factors you just mentioned there, is what's the vaccine. So we still have a requirement for workplaces to report when they have those 2 or more cases, because we want to be able to reach out, try to have that access to testing and vaccine. And if necessary, if we feel that the outbreak can't be achieved in another manner, then certainly the temporary closure of the business is an option.
I have another question. Do you think you or public health will be exercising the health hazard declaration with more frequency going into the fall, especially in Southern Health, where we've seen businesses not comply with the current restrictions?
That's hard to predict, but it's always an option, and we're going to utilize that where we feel it's necessary.
Time for a couple more, and then we'll wrap up.
Dr. Roussin, we do see some breakthrough infections. Obviously, it's often said the virus is more, the vaccine rather, is more of a dimmer switch than it is a automatic wall of lead that just prevents any infections. What advice would you have for the fully vaccinated to avoid contracting COVID from the unvaccinated?
So I think, this is still the fundamentals are still going to apply in these circumstances. We know that vaccines very effective. No vaccine, no medical treatment is 100%. So we are going to see some of these breakthrough cases. We see very few severe breakthrough cases. We know that when the vaccinated, if they do come down with COVID, they're less likely to transmit to others. So there are a lot of benefits to this. And so still the messaging is the fundamentals. When you look at our restrictions where we restrict many higher risk activities to the fully vaccinated, then you have a lot of benefits on top of that, right? There's less likely to be a COVID case within those populations. There's less likely to transmit within those populations. And if anyone was able to acquire it, they're much less likely to be able to have a severe outcome. So all of our approach is to decrease that risk. And then everyone should still be thinking about those fundamentals.
And you were asked earlier today just about the projections. Aware on the various scenarios presented in August, high, low, extreme, where would you say we are right now compared to where you thought we might be on that chart from 6 weeks ago?
So I think that our fourth wave was, more delayed than what early projections had shown. But we're certainly on the trajectory of the severe outcome there, severe trajectory right now, that certainly could change over time. But that's why we've felt further action was needed at this point.
Thank you, doctors. Thanks, everyone. This concludes our session.